This is Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're coming to you from Orlando, Florida at the annual AACR meeting, and we're honored to have Dr. Gina DeNicola here, who is chair of our Department of Metabolism and Physiology. Thanks so much for coming here today with us.
Thanks for having me. And
Great.
I'm here also with Janine DeBlasi from my lab, who presented a poster here at AACR.
Great. Tell us about the poster, Janine.
Sure. So we're studying the KEAP1 NRF2 pathway in lung cancer, and we looked at the effects of mutations with murine alleles on lung tumor initiation and progression. And so what we found is that these mutations alone were not sufficient to cause lung tumor formation, but in the context of mutant KRAS, they were able to promote lung tumor initiation and early progression to low-grade tumors. However, we also found in the KRAS P53 model of lung adenocarcinoma that high NRF2 activation blocked progression to advanced grade tumors. And we saw that this was reversed by NRF2 deletion. So overall, our study suggests context dependence for NRF2, as well as an importance for threshold in lung tumorigenesis.
I see. So it's really multiple mutations that cause the cancer. So how is NRF2 mutations doing this? Is it altering the metabolism of the cancer cell, or what is going on?
So we think there's a few possibilities. We know that there is an elevation of NRF2 related metabolites that are involved in glutathione metabolism elevated in these models.
Right, and the antioxidant production by NRF2 really helps cancer cells survive the initial stress and tumor initiation. But the real surprise was the block in tumor progression, given that KEAP1 is a tumor suppressor in lung cancer. And so we're not really sure what's happening there. That's what Janine's trying to understand now.
I see. So often questions lead to more questions, right?
Exactly.
Answers lead to more questions. That's wonderful. So tell me, what does this mean to a lung cancer patient? Is it going to help in the personalization of treatment?
It could potentially. We're looking into comparing potentially the levels of NRF2 in our mouse models and how that relates to patient tumors. I think also there are companies working on developing NRF2 inhibitors, so maybe some consideration should be given there as well.
And this interacted with KRAS, and so there's a number of KRAS inhibitors. So do you also see combinations with those KRAS inhibitors?
Potentially, yes.
Yeah, so we really don't understand how this would impact. We haven't treated our models yet with KRAS inhibitors, so that's something we could do.
See. And people say, oh, this is a KRAS mutated tumor model, but actually there are many different subsets of KRAS mutated tumor models, right, in lung cancer patients, and every subset, such as the KRAS NRF population, is going to potentially be treated differently, right? Yeah. Wonderful. Well, thanks so much for being here with us at AACR in Orlando, Florida.
Thank you.
And everyone should check out Janine's paper that just came out 2 days ago in Cancer Research.
Absolutely. Well, congratulations.